I'm Stephanie from WorkSafe Tasmania, and I'll be your moderator today. In recognition of the deep history and culture of this island, we acknowledge Tasmanian Aboriginal people, the original and continuing custodians of the land, sea and sky. We acknowledge and pay our respects to all Tasmanian Aboriginal people, all of whom have survived invasion and dispossession and continue to maintain their identity, culture and Aboriginal rights. Please take a moment to look at the current slide regarding information received today. Please use the chat window to type and submit questions for today's presenter. Those questions will be answered at the end of today's webinar. And only presenter webcams will be used. Today's presentation is also being recorded. It is now my pleasure to introduce your presenter from Work Rehab, Glynn. Karen has worked as a psychologist for the Department of Defence, helping military personnel with their mental health needs. She offers services like mental health screenings, critical incident support, and assessments for job suitability. Karen is also a skilled trainer teaching topics such as suicide awareness, stress management, and health and wellbeing. With nearly 10 years of experience in vocational rehabilitation, Karen excels in handling complex cases, helping individuals adjust to their injuries, offering career counselling and conducting vocational assessments. Karen's strong interpersonal skills allow her to effectively support the families of both active and former Defence members, and we welcome Karen today.
Thanks, Stephanie. Thanks for the introduction, and good afternoon, everyone. So we'll start with what is going on today in today's content. So this presentation is going to include understanding the difference between a primary and secondary psychological injury and the main causes and factors of secondary psychological injuries. We're going to briefly look at some statistics and trends of both primary and secondary psychological injury claims. We're going to look at the cycle of how a secondary psychological injury emerges and indicators to look out for that might suggest an injured worker is developing a secondary psychological injury. We're going to have a discussion about what could be done to help reduce the occurrence of a secondary psychological injury and the interventions that each stakeholder could implement. We're going to talk about understanding psychological safety at work and how to create a culture of healthy habits that align with employer obligations to manage psychosocial hazards. We'll include some recommendations to help improve mental wellbeing and prevent psychological injury claims, particularly secondary psychological injury claims. And there'll be an opportunity for us to reflect on our own wellbeing before then having the opportunity for some questions. Okay. So before I move on to the next slide, I would like to ask a question. And I'd like to ask if you could pop in the chat box what your answer to this question is. The question is, what is the most common cause of primary psychological injuries in the workplace? So I'll repeat that again. What is the most common cause of primary psychological injuries in the workplace?
So comments coming through, Karen: work-related stress, bullying, stress, bullying and harassment, stress again. Direct trauma events, perceived bullying, workload.
Okay, workload, a little too much. Yep, so bullying. Okay, thank you. So to start with, is primary psychological injury can occur at work when an employee is directly exposed to situations such as occupational violence, harassment, a traumatic event, and psychosocial hazards such as work pressure. A psychological injury can adversely impact the employee's mood, the thoughts, the behaviour, which might possibly be diagnosed later as a mental illness. Mental illness can include a range of cognitive, emotional, and behavioural symptoms, which may ultimately interfere with the employee's functioning and can significantly affect how they feel, think, behave, and interact with others. And so the most common cause of primary psychological injuries in the workplace is work-related harassment and or workplace bullying. So I'll say that again, the most common cause of primary psychological injuries in the workplace is the workplace-related harassment and workplace bullying, which is quite sad. The second most common cause of primary psychological injuries is work pressure. And the third is exposure to a traumatic event. Now, psychological injuries continue to rise in number and severity. And New South Wales data shows that psychological claims rose 30% between the financial years of 2018 and 2019 and 2022 to 2023, compared with 11% for physical claims. The average cost and time off work for psychological injuries is more than triple that of physical claims. Now, did that just go back a minute? Yeah. Okay. So according to WorkCover Queensland 2021 to 2022, 6.1% were mental injury claims, costing $61,047 per claim, with 181.4 days of work. Physical injury claims cost $28,163 per claim, with 72 days off work. According to Safe Work Australia, as at 2023, claims for mental health conditions have increased by 43% over the past 10 years, a greater increase than any other type of injury or illness. These claims lead to compensation payouts almost 4 times larger than other injuries and lead to 4 times more absences. Serious mental health claims were more common among certain industries who may be more at risk. This included healthcare and social assistance, public administration and safety, and education and training. According to Safe Work Australia, psychological injury claims accounted for 9.2% of all serious workers' compensation claims in 2021 to 2022. Psychological injury claims are more costly in terms of time off work and compensation payments than physical injury claims. Specifically, the median time lost from work due to a psychological injury claim was 34.2 weeks, compared to 8 weeks for a physical injury claim. The median compensation payment for a psychological injury claim was $58,615, compared to $15,743 for a physical injury claim. According to the Australian HR Institute, between 2019 and 2022, there were waning resilience levels. 68.5% of workers reported a sense of burnout. 62.4% hybrid workers reported feeling burnt out. Reduced discussion of mental health concerns, 31.9%, or accessing work mental health programs, 33.1%. There was a reduced sense of psychological safety at work and a reduction in perceived valuable and worthwhile work. Now, I note this workplace report covers the time period during which we experienced COVID-19 pandemic, which raises the question about whether our sense of psychological safety at work and resilience levels have fully recovered. But we'll look into psychological safety in more detail later in this presentation. So, secondary psychological injury. This is a mental injury caused by the primary work-related physical injury and can be accepted under workers' compensation legislation. A secondary psychological injury can occur as a result of chronic pain, workplace issues or barriers that impact pain or functioning, original workplace incident that caused the claim, for example, a traumatic event, longer than anticipated recovery timeframes, unfavourable recovery outcomes, so that means the worker may not have been able to regain full function, physical functional limitations, so the worker can't do what they used to, and thereby affecting employment prospects. Claim-related factors including the duration of the claim, There also could be legal matters, time away from work, and access to intervention, treatment and support, and also the workplace isolation, poor support and or communication from the employer, ambiguity, and ineffective management styles. Predating risk factors that can make an employee more vulnerable to incurring a secondary psychological injury include pre-existing conditions, financial troubles, lack of support networks, and personal relationship issues. According to several studies, somewhere between 25% and 45% of workers with an accepted workers' compensation claim for a physical injury develop a secondary psychological injury. More than 7% of employees with a physical work-related injury develop a secondary psychological injury within 18 months. Professor Alex Colley describes secondary psychological injuries as a range of mental health problems in workers with physical health conditions, from clinically diagnosed mental health disorders to other subclinical mental health issues that emerge sometime after a person suffers a physical injury or illness. These mental health conditions prolong return to work and have serious negative health, family, and social and financial consequences for employees. They can also be complex to treat and support and are costly for work injury schemes. This graph, provided by WorkCover Queensland in June 2023, shows the proportion of physical injury claims in blue, primary psychological injury claims in orange, and secondary psychological injury claims in grey, across a 10-year period up to the 31st of March 2023. It reveals an alarmingly growing trend of secondary psychological injury claims. Interestingly, the number of physical injury claims appears to have reduced, and the number of primary psychological injury claims remained relatively steady, with a slight increase from 2021. This graph, provided by WorkCover Queensland in June 2023, shows the proportion of secondary psychological injury claims in government organisations, which is in orange, and private organisations, which is in blue, across a 10-year period from March 2013 to March 2023. It reveals an alarmingly higher number of secondary psychological injury claims in the private sector compared to the government sector. It can still be seen, however, that overall, secondary psychological injury claims have steadily grown across both sectors over that 10-year period. This is an example of the typical cycle that leads from a physical injury to the increased risk of developing a secondary psychological injury. Firstly, an employee experiences a physical injury which results in reduced or no capacity for work and potentially physical pain. This reduced functioning then starts to take a toll on how they process their recovery. The employee may begin to start catastrophizing, becoming preoccupied and fixated on their injury and their limitations, and experience feelings of anger, helplessness, rumination, and being out of control. In turn, this starts to negatively impact on the individual's mood and overall sense of well-being, often leading to withdrawing and avoiding their usual activities and social engagements. The accumulation of all these factors formulates the perfect ingredients for a heightened risk of physical and mental health decline, which can ultimately result in developing a secondary psychological injury. By understanding this cycle, recognizing the indicators of mental health decline, and implementing early intervention strategies together with proactive measures, the sooner the injured employee will make a recovery and return to work. Indicators that a secondary psychological injury could be developing can often be subtle and indirect, so listening out for cues is absolutely critical. For example, increased pain might sound like, "I can't look after my child like I used to." Relationship strain or anger. I'm arguing more with my partner since being at home. They just don't understand. Worrying about re-injury could sound like, my shoulder feels better, but I'm so scared of hurting it again. I can't be in that much pain again. Anxiety around returning to work might sound like, everything has changed since I've been injured. I have a new manager and a new team. I don't know anyone. Sleeplessness. I'm not sleeping well and I feel so tired. Loss of drive and motivation, low engagement may sound like, I'm just not interested in the same things anymore. I'm having trouble getting up and I just can't bring myself to get on with my usual routine. So we know what a secondary psychological injury is. We know this has been a growing problem, and we know some of the symptoms that an employee might present with that indicate a possible secondary psychological injury. But what could be done to help reduce this occurrence? I'd like us to take some time to explore these questions one at a time. And once we've covered this, we'll then move on to explore methods and how to improve psychological health and safety in the workplace. So question 1. What could case managers do to mitigate the occurrence of secondary psychological injuries? The second question, what early intervention strategies could employers implement to reduce the likelihood of secondary psychological injuries? Question 3, what could an individual do to minimize their risk of acquiring a secondary psychological injury? And the fourth question is, what could a treatment provider do to lower the likelihood of a secondary psychological injury? So as you can see here, we're taking a holistic approach that each and every stakeholder plays a really important part and a role in the recovery and return to work process. So case managers, rehabilitation providers, and employers could improve reaction and service delivery times. Within 6 to 12 weeks is considered a crucial time period to have the issue addressed. Approach with an impartial, professional, and fair process and show good decision making and having a hold of the matter. Having awareness of injury factors that are exacerbating distress and or are reducing protective elements. Improve the initial screening time at the onset of the injury claim to consider the most appropriate and relevant support for their mental well-being. Demonstrate accountability, transparency, strong support and regular communication. Maintain some sense of work capability where possible and focus on what they can do rather on what they can't do. What can treatment providers do? This is the active versus the passive treatment. Ask the individual questions. Be more inquiring. Refer the individual to counselling. There are specific counsellors who offer adjustment to injury counselling, and there are pain psychologists who assist those suffering from chronic pain. Be more open and encouraging of a graduated return to work with regular medical reviews rather than being overly conservative and taking a blanket approach of being totally unfit for work for extended periods of time. Apply a multifaceted treatment approach, keeping the channels of communication open amongst all treating practitioners and taking a holistic approach to the situation, ensuring to include regular communication with the treating mental health practitioner. Educating individuals about mental health conditions to help the individual with recognising, normalising and reducing stigma associated with such conditions. And further, they could promote activities that assist with improved social and mental functioning, for example, engaging in activities with meaning, purpose and enjoyment. What can employees and individuals do? Individuals themselves should access appropriate social supports and networks and may need information regarding these. Employees ought to be encouraged to fully participate in recovery management plans with the benefits explained to them. Access education and developing self-awareness skills to recognise mental health symptoms and triggers. This will be immensely helpful. Circles of influence. Essentially, this is a concept that helps individuals to focus on the things that they can control or influence and accept the things that they cannot. So you may have heard the saying, when you can't control what's happening, challenge yourself to control the way you respond to what's happening. That's where your power is. So although we may not be able to control the situation, what we can control is our response to it. The smaller circle in this diagram is the circle of control, which is what we can directly control or impact through our thoughts, words, and actions. The middle circle is the circle of influence. This is about the concerns we can do something about. We do not have control over the outcome, but can influence it with what we are able to control. And the larger circle is the circle of concern, and this is about the wide range of concerns of which we have no control over the outcome. Before addressing this model on the slide, I want to highlight that providing suitable duties that are meaningful, which help the employee to feel valued, is critically important in helping to reduce the likelihood of a secondary psychological injury developing. After identifying the inherent or core requirements of the employee's job and assessing the injured employee's skills and abilities, identify reasonable adjustments with the injured employee. Find out what reasonable adjustments may be required to maximise job efficiency, a successful return to work, and to minimise the onset of a secondary psychological injury claim. Most adjustments or changes to the working environment are simple, they cost nothing or are inexpensive, and the adoption of broader strategies and policies frequently benefits all employees. When identifying reasonable adjustments, be flexible, that is, be open to the many options available. Flexibility is the key to identifying reasonable adjustments that are going to work for the employee and the business. Think laterally. There is no set formula for identifying reasonable adjustments. So look at the individual needs of the person, the core requirements of the job, and then think outside the box for solutions. The best adjustments are often the most creative ideas. And look for good ideas. Investigate what has worked well for others. Adapting good ideas to match employee needs and workplace requirements leads to success. Check that the employee can meet the inherent or core requirements of the job when reasonable adjustments have been identified. Once reasonable adjustments have been made and sufficient time has passed, objectively assess whether the employee has the ability to meet the core requirements of the job. Evidence shows that returning to work aids recovery and can help promote a sense of well-being. So this model here illustrates the impact of job demand and sense of control and the amount of resources and support available to employees. Stress and low motivation are a result when the demands and risks of the work outweigh the resources, including the internal sense of control or the locus of control the employee has available to them. Stress thresholds need to be considered. If there is not enough demands or challenges, the employee can feel underwhelmed and experience low motivation. On the other hand, if the demands or challenges outweigh the employee's perceived ability and capacity to cope and deal with them, they may feel overwhelmed and struggle to perform. Restrictive motivation results in 3 types of behaviour: procrastination, creative avoidance, minimal effort, and poor job performance in order to get things done. So there are a lot of cogs in the wheel that need to be considered and activated to help reduce the likelihood of a secondary psychological injury developing in an employee who has incurred a physical injury. Not only must we intervene early and have awareness to recognise the risks, symptom indicators, and understand how to respond, which is a reactive approach, we must implement a proactive approach. That is, establish, maintain, and promote psychological safety at all times in the workplace, and promote good mental health amongst all employees. So far we have addressed how various stakeholders could intervene at the early signs of a secondary psychological injury and how those stakeholders could support recovery. But now we will address the importance of embedding psychological safety as a crucial part of an organisation's culture and discuss some tools and approaches that may help employees maintain good mental health and increase the likelihood of a return to work after incurring a physical injury without developing a secondary psychological injury. So here we have some actions that could be implemented to improve psychological safety at work. This could include creating a strong structure and expectations about how well-being at work should look, from top down and also from bottom up. Give regular praise and recognition. Prepare and train employees sufficiently to undertake their duties and accommodate where necessary. Manage employees' workload and priorities. Promote inclusivity, opportunities to contribute, offers of growth and development. Ensure to allocate and utilise resources. Empower employees to control and self-regulate how they manage their tasks and routines. Consider what motivates the employee, their values, and enable adaptation and flexibility. And encourage relationships, connection, and trust amongst the colleagues. A lot of this is navigating around managing the psychosocial hazards that can emerge in the workplace, such as emotional demands of the role, role ambiguity, role conflict, role overload or underload, relationship conflict, task conflict, low job control, poor co-worker support, poor supervisor support, inadequate praise and recognition, procedural injustice, poor organisational change consultation, workplace bullying, and work-related violence and aggression. So shortly, we're going to have a listen to this TED Talk about the importance of building psychological safety in the workplace. It's an 11.5-minute video, which is presented by Dr. Amy Edmondson. And the key takeaway message is that when we feel safe and supported to learn, challenge, and share in the workplace, a culture of healthy habits and psychological safety grows. 3 key points from this video include framework as a learning problem, not an execution problem. Don't just focus solely on execution. Acknowledge your own fallibility and tendency to make errors. And model curiosity. Ask a lot of questions. Encourage and free people up to engage with each other and have a voice to speak up. Generally speaking, psychological safety is built on these 4 pillars: feeling included, feeling safe to learn, feeling safe to contribute, and feeling safe to challenge the status quo. And remember this quote: the standard you walk past is the standard you accept. So now we'll watch this TED Talk video for a little while, for 11.5 minutes. Thanks.
A nurse on the night shift in a busy urban hospital notices that the dosage for a particular patient seems a bit high. Check the order. Just as fleetingly, she recalls his disparaging comments about her abilities last time she called him at home. All but certain the dose is in fact fine. The patient is, after all, on an experimental protocol which justifies the high dose. She heads for the cart, gets the med, and goes toward the patient's bed. Quite far from the urban hospital, a young pilot in a military training flight notices that his senior officer might have made a crucial misjudgment. He lets the moment go by. Far from both of those stories, a senior executive who has recently been hired by a very successful consumer products company to join the top management team has grave reservations about a planned takeover. New to the team, feeling like an outsider, everyone else is so enthusiastic about the plan, he doesn't say anything. These are 3 episodes of workplace silence when voice was necessary. Voice would have been helpful. Now, you may think, if I were in their shoes, I wouldn't do that. Or you may be aware, as I am, of just how often this happens in the modern workplace. So I've been fascinated by this problem for a long time. Why does this happen? It's quite simple, actually. It turns out that no one wakes up in the morning and jumps out of bed because they can't wait to get to work today to look ignorant, incompetent, intrusive, or negative, right? No, on average, we'd prefer to look smart and helpful and, positive and helpful. So the good news about all this is that it's very easy to manage, right? Don't want to look ignorant? Don't ask questions. Don't want to look incompetent? Don't admit weakness or mistake. Don't want to look intrusive? Don't offer ideas. And if you don't want to look negative, by all means, don't criticize the status quo. Okay. Now, this strategy, the good news about this very successful strategy is that it works for self-protection. The psychologists call this impression management, and there's a great deal of evidence that we're quite good at it. We learn how to do this sometime in grade school. By the time we're working adults, it's all but second nature. Have you ever had a question and you look around and you don't ask it, no one else seems to be asking, maybe you're supposed to know. You think, I'll figure it out later. So why does this matter? It matters because every one of these moments, every time we withhold, we rob ourselves and our colleagues of small moments of learning. And we don't innovate. We don't come up with new ideas. We don't, we are so busy, unconsciously for the most part, managing impressions that we don't contribute to creating a better organization. The nurses don't call. The pilot doesn't speak up. The executive doesn't say anything. So the good news is that not every workplace is, in fact, this way. There are some workplaces where people absolutely wake up in the morning, if not eager, at least willing and ready to take the interpersonal risks of learning. I call these special workplaces ones that have psychological safety. Now, I'll define psychological safety as a belief that it's absolutely okay, in fact, it's expected, to speak up with concerns, with questions, with ideas, with mistakes. And I got into this, I got interested in this actually quite by accident. Let me tell you how it happened. I joined a team of mostly physicians and nurses, and the job of that team was to find out, to assess, they hoped conclusively, what the actual rate of medication errors was in, let's say, some modern tertiary care hospitals. So their job was to set out to collect data on drug errors, human-related drug errors. My little part was very simple. I was going to ask the question and answer the question of, do better teams, better hospital patient care teams, make fewer mistakes? I used a standard team survey measure to assess the team effectiveness, and trained nurse investigators visited a number of units in 2 hospitals every couple of days for 6 months. These were the data that they came up with. Now, these are adverse drug events, errors, just call them medication errors, that were deemed to be based on human error, expressed in terms of errors per 1,000 patient days. Now, here's where the story gets a little weird. I got the data, I waited patiently, I got the data on the teams, I got the data on the errors, and I ran my analyses. And what did I find? The results were exactly the opposite of what I had expected. It appeared that better teams were making more mistakes, not fewer. Now, from the point of view of a young researcher wanting to publish a paper, this was a real problem. Never mind the other problems, right? And so this was a problem. No, this was a puzzle. So I sat down to think, why else might? I thought about the need for coordination between physicians and nurses. I thought about the need for teamwork on the fly, for speaking up, for double checking. And I thought maybe, in a kind of blinding flash of the obvious, I thought maybe the better teams aren't making more mistakes, maybe they're more willing to discuss them. What if the better teams have a climate of openness that allows them to report and even get to the bottom of these things? Now, having that insight was a far cry from proving it. So what did I do? I sent out a young research assistant to study these units very carefully. He had to have no preconceptions. He didn't know the error rates. He didn't know how they scored on the team survey. He didn't even know my hypothesis. And I said, what do you learn? And you know what he found? He found that these units, these 8 units, were wildly different in terms of whether they were willing and able and did, in fact, talk about errors. Some of them were actually actively talking about them all the time, and in the process of trying together to work together to find new ways of reducing them. I called this, much later, I called this psychological safety. Now you might want to know, what was the sorting rule in this chart? It looked at first like I was trying to get it from highest error rate to lowest, and I just am not very good at math and got mixed up in the middle. No. These are sorted by the research assistant's ratings of the openness of the climate. As you can see, the correlation is very high indeed. Okay, so how do you build it? What do you do? If you're a leader and you say, wow, I want to have psychological safety in my workplace, let me just suggest 3 simple things you can do so that that nurse does make the call. The pilot does speak up. The executive even reveals his concern about the takeover. First, frame the work as a learning problem, not an execution problem. Recognize, make explicit that there is enormous uncertainty ahead and enormous interdependence. Given those 2 things, we've never been here before. We can't know what will happen. We've got to have everybody's brains and voices in the game. That creates the rationale for speaking up. Second, acknowledge your own fallibility, right? You know you're fallible. Say simple things like, I may miss something. I need to hear from you. This goes, by the way, for subordinates and colleagues, peers alike. That creates more safety for speaking up. And third, model curiosity. Ask a lot of questions. That actually creates a necessity for voice. And so these 3 simple things can go a long way toward creating the kind of workplace where we can avoid the catastrophes you saw coming in those 3 opening vignettes. Now, at this point in describing and teaching about these things, most managers I talk to start to get a little nervous, right? They say, I get it. I understand how this could really help people learn. I understand, and I want to hear about errors. But are you saying I have to dial back a little on excellence? Is it no longer possible to hold people accountable for great results, to hold their feet close to the fire? And I say no. In fact, I don't think it's a trade-off. I think it's 2 separate dimensions, right? 2 dimensions that you have to think about. In fact, when I'm talking about psychological safety, I'm essentially talking about letting up on the brakes, right? I'm not talking about the gas. Right? I'm not talking about motivation. There's a lot out there on motivation, and it's really important, and it's important to understand it. But I'm talking about it's equally important to free people up to really engage and not be afraid of each other. So if you don't do either, by the way, that's the apathy zone, and that's quite sad. So let's move on. If you only do psychological safety, yes, well, it's possible. You're creating a comfort zone, leaving money on the table, right? But this is the one I'm more worried about, and I wish more managers were worried about it too, right? If you're only talking about people's accountability for excellence and not making sure they're not afraid to talk to each other, then they're in the anxiety zone. This is where the nurse was. This is where that young pilot was. Even the senior executive was in this place, and that's a very dangerous place to be. So, of course, where do I want you to be? I want you to be high, in the learning zone. And let me just say, in case it wasn't clear yet, that this is also one and the same as the high performance zone as long as there's uncertainty and interdependence. If you have no uncertainty and no interdependence, it's fine. You don't need psychological safety, really. It's fun to have, but not necessary. But if you have both uncertainty and interdependence, it's absolutely vital that you have psychological safety. So the workplace out there, the complexity, the interdependence, it's not going to go away anytime soon. We need people to bring their absolute full selves to the challenging jobs ahead. And I hope you will help me create those kinds of workplaces so that they can learn and become their full and most contributing selves. Thank you.
Thank you. Okay. So without taking a proactive approach with implementing a healthy culture towards psychological safety, we will simply be reacting and surviving and not thriving. With a lack of perceived control together with disengagement, the risks are that there will be reduced self-regulation, cognitive and executive functioning in individuals, decreased interpersonal capacity, compassion and empathy, restrictive motivation, such as procrastination, creative avoidance, minimal effort, a compromised immune system, disrupted sleep, withdrawal, sense of isolation, and reduced self-worth and esteem. An increased risk of decline in mental health with possible adverse psychological symptoms and a higher risk of both physical and psychological injuries. So what are our recommendations? Provide managers with evidence-based mental health training to improve their recognition of and response to the first signs of mental illness and related risk factors in the workplace. For example, complete a mental health first aid course. Implement evidence-based protective mental health and wellbeing interventions for all employees to improve resilience and wellbeing. Adopt proactive strategies that promote protective factors and early help seeking for those who are physically injured or ill. This approach is an effective way to help reduce the onset of mental illness arising and leading to secondary psychological injury claim. Build mentally healthy workplaces through organisational level strategies that facilitate worker autonomy, improve job control and flexible work to help reduce work pressure and enable a graduated return to work. Take immediate preventative action on any workplace bullying, harassment, stigmatisation, ostracisation and assault. These are all strongly associated with adverse mental health outcomes. Further to the previous slide, improving employee resilience and wellbeing, for example, could involve offering physical activity programs, that is, reimbursing employees an amount towards a gym membership or running shoes perhaps, or offering mindfulness programs and access to an employee assistance program if available. Ensure all employees are familiar with the free national and local 24-hour phone and online counselling services, as well as the smartphone apps. Recently, it's been demonstrated that individual-level preventative programs can be effectively delivered via smartphone apps to both the general population and the employee population. For example, Headgear is a free app from the Black Dog Institute. It uses behavioural activation and mindfulness and has been demonstrated to be effective in preventing symptoms of depression in Australian workers. Another app includes Soothing Pod. This offers guided meditation, sleep stories, relaxing music, sleep nature sounds. Numerous resources are available across Australia, including state and national government authorities that offer free training and coaching to help make your workplace a mentally healthier and safer environment. Workplace wellbeing assessments and psychosocial risk assessment surveys are also offered through various organisations, such as peopleatwork.gov.au, for example, and further information about this is on the next slide. Seek out private businesses that offer a range of training workshops, e-learning programs and presentations for workplaces to build better mental health at work. For example, Black Dog Institute offers this service and currently offers free mental health training funded by the New South Wales Government, for example, to New South Wales businesses who are not-for-profit, who have less than 200 employees. So state by state, there are various organisations that will help workplaces to embed better mental health strategies. So on the next slide, we're just going to cover a couple of these resources. So firstly, the Health and Safety Executive UK offers a stress talking toolkit. That's to help prevent work-related stress. The toolkit is designed to help managers talk with workers as part of their overall approach to preventing and managing work-related stress. It helps to start conversations to identify causes of stress and identify possible solutions. There is also, as I mentioned previously, People at Work. This is a free, validated Australian psychological resource and risk assessment survey to help create psychologically healthy and safe workplaces. The Black Dog Institute. This also offers a webinar series that provides evidence-informed and real-world insights from leading researchers, workplace professionals, and lived experience advisors on how you can engage your workplace, reduce psychosocial risks, and promote mental health and well-being at work. So to summarise the key points, secondary psychological injury claims are continuing to grow. It's essential to know the triggers, risks and symptom indicators and remain vigilant for signs of a possible secondary psychological injury. Early intervention, regular communication and awareness of mental health are crucial. Identifying reasonable adjustments required to return injured employees to work will help reduce the likelihood of them incurring a secondary psychological injury. It's essential to understand and promote psychological safety and a culture of healthy habits. Adopting proactive strategies that promote protective factors and early help seeking for those who are physically injured or ill is an effective way to help reduce the onset of mental illness arising and leading to a secondary psychological injury claim. Implementing individual level interventions to employees will help to support their psychological well-being and work performance. So finally, where are you at today? How are you going? Where do you see yourself today on this 5-point wellbeing scale? It's important for us all to take some time to pause and reflect on how we are doing. This quick reflection piece enables us to individually ascertain a sense of self-awareness and expand our thoughts to what is working and what is not working. What do I need more of or less of today? Do I need support? What sort of support do I need to go and access? This is a small and straightforward but profound activity and highly recommended in the practice of your daily self-care. It's important to remember also to focus on the positive things in our lives and have gratitude and appreciation for many of the things that serve our basic needs, such as a nutritious meal, a hot shower, a supportive friend or a relative, being productive and having a sense of purpose and serving others and our community through our jobs, our family, volunteering, or simply just being a good Samaritan. These things can foster a positive sense of well-being. So ask yourself, what have I done today, this week, this year, to help another person, my employer, my colleagues, my community? How am I contributing to make this a better world? And a couple of little statements here to wrap up. It takes practice to become mentally strong, even without injury. It takes even more practice after an injury. Just as physical strength needs repetition and practice to improve, the mental side also needs this. And finally, the development of any type of psychological injury is influenced by the way employees are supported before, during, and after a challenging incident, whether that incident be a traumatic event or a physical injury or illness. So again, the message is proactiveness. It's how people are influenced and what people are doing before an incident arises. Well, thank you very much for your time. That is the information. Yeah.
So thank you to our presenter, Karen Glynn from Work Rehab. There's time to type any questions in the chat for our presenter today. A reminder as well that today's webinar has been recorded, so please head to WorkSafe Tasmania's YouTube page to rewatch and share today's presentation, or have a look at other webinars that we are running during WorkSafe Tasmania month. Are you able to provide the name of the TED Talk, Karen?
Yeah, sure. So the TED talk was How Do You Build Psychological Safety? And it was presented by Dr. Amy Edmondson, Edmonson.
Thanks, Karen.
That's okay.
With no further questions coming through, Karen, I'll begin to wrap up today's presentation. So thank you again to our presenter, Karen Glynn from Work Rehab, for her webinar, Understanding and Preventing Secondary Psychological Injuries. Today's webinar has been run as part of WorkSafe Tasmania Month. WorkSafe Tasmania Month is an initiative that is funded by the WorkCover Board Tasmania. Please head to worksafe.tas.gov.au to see what other webinars and in-person events we are running throughout the month of October. Today's presentation has also been recorded. Please head to WorkSafe Tasmania's YouTube channel to rewatch and share today's presentation, and also see what other webinars we have in store for you as well. Thank you again to our presenter. Thank you for everyone who attended today's presentation. Please have a safe and healthy rest of the working day.